Hello, my name is Taylor and I'm going to be your nurse today. Can you tell me your name?
Cameron Lafitte.
And how old are you?
22.
Okay, and I have it in the chart that you're here for a cardio and a peripheral vascular assessment. Is that correct? Okay, so throughout the assessment, there's going to be a lot of listening and palpating. I'm going to have you sitting up and laying down throughout the assessment. If at any point there's any pain, discomfort, or if you have any questions, just let me know, okay? All right, I'm going to wash my hands. Okay, and then now we're going to get started, okay? All right, so we're going to start with your upper extremity, so your arms. So to start, I'm going to have you hold your arms out for me. So to begin, we're going to look at the symmetry of your arms to make sure that they are symmetrical, and they are. Your hair distribution is equal. And then your skin is warm and dry to touch. Skin turgor bounces back. It's good. Bilaterally, we're going to check to make sure cap refill is less than 3 seconds bilaterally, and it is. I'm going to have you flip your hands upside down for me. We're going to check your radial and your brachial pulses. So your radial pulse is right here on this side, and it is right here on this side. And then we're going to compare the both, just make sure that they're equal, and they are equal and strong bilaterally. And then up here we have your brachial, and then it's on this side, it can be found right here, and on this side right here. And they are equal and strong bilaterally. Okay, and then I'm gonna have you squeeze both of my fingers. Okay, and that's just checking for grip, and it is strong. You can relax your arms now. Now we're gonna move down to the neck area. I'm gonna have you kind of brush your hair back for me. Okay, so inspecting the neck, I don't see lumps, bumps, or any bruises. I don't see any pulsations. I'm going to palpate down each side of the neck. I'm gonna do one side at a time. That way we don't, if we do both at the same time, it can make you pass out. So we're just gonna do one at a time. So starting on this side, we're gonna do it 3 times going down, using 2 fingers. Okay, and it is strong, pulse is strong. Okay, alrighty. And then now we're gonna listen, and whenever I listen, I'm gonna use the bell side of the stethoscope, which is the small side. I'm gonna have you take a deep breath in, and then you're gonna let out all of your air, and then you're gonna hold it until I tell you you can relax, okay? So you can take a deep breath, let it go, or relax, and hold it. Start over, I'm sorry. Take a deep breath. Let out all your air and hold it. Okay. Take a deep breath. Let out all your air and hold it. Alrighty, and then now what we're gonna do is move down to the chest area. So as I go down, I'm listening for any murmurs. I'm listening to make sure that S1 and S2 is heard. And then as I move down, I'm going to call out the different areas that I'm listening to, and just so you kind of know which, where about they're located at, throughout the area of the chest, or the areas of the heart. Okay, so we're going to start with using the diaphragm. So we're going to use the large side of the stethoscope. So we're going to start with finding this part, the end of the clavicle, and we're going to go down the sternum to the second intercostal space, so about right here. On the sternum's border, it's the right side, second intercostal space. and that's going to be your aortic. And then in the left intercostal space, down the sternum border, is your pulmonic. The third intercostal space on the sternum's border is your Erb's point. And then the fourth intercostal space is your tricuspid. And then going down the mid-clavicular line into the fifth intercostal space is going to be your mitral area. And then we're going to do all those same areas just using the bell side of the stethoscope. So again, trace the clavicle down to the second intercostal along the sternum. So I have your apical, your pulmonic, your Erb's point, your tricuspid, and your mitral. Okay. A minute ago I said aortic. That's actually your, no, I said apical, it's your aortic. Okay, and then now I'm gonna have you, well, I didn't hear any murmurs, and then S1 and S2 was heard, so that's good. No, go ahead, lay down, sorry. Oh. So I'm gonna have you lay flat on your back. Okay, and then I'm gonna looking at jugular distension. I'm gonna have you look all the way towards this way for me. So looking along the neck right here, we're just looking for any jugular distension or any visible pulsations. And then while we're also inspecting, we're looking for any lumps, bumps, or bruises. Look the opposite direction for me. And then we're looking along this way. And then same inspection, no pulsations, lumps, bumps, bruises. Okay, alrighty. And then now we're gonna look at the pericardium area. Using the ulnar side of the hand, we're just going to kind of palpate the area, just kind of feeling for any pulsations, pulsations. And none are felt. And then we're gonna go through and just kind of palpate using 2 fingers, those same areas we listened to. So I'm gonna locate those areas. So we have aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay. And then also the mitral. Using 1 finger, you can feel for the apical pulse. It's not always felt, but. And then we're gonna go through and listen to all those same areas using both sides of the stethoscope as well. Okay. All right, so we have our aortic, pulmonic, Erb's point, our tricuspid, and our mitral. Aortic, pulmonic, Erb's point, tricuspid, and our mitral. Okay, and then I'm gonna have you roll onto your left side so we can hear your mitral valve. So right here, the mitral valve should be able to be heard Okay, and then roll back over. Alrighty, and then now we're going to go down to the lower extremities. So going down this way, we're going to start with making sure they're symmetrical, and they are. We're going to check for you have even hair distribution, so that's good. Skin is warm and dry to touch. No edema, no varicose veins. Okay, and then capillary refill is less than 3 seconds on lower extremities bilaterally as well. Okay, and then I'm gonna pull these down, and then we're gonna check the pulses in the lower extremities. So right around the groin area, you have your femoral area right here, right about right here. Check with 2 fingers. Strong bilaterally. Underneath the knee, we check with 2 fingers, comparing both. They're strong bilaterally. I need you to twist your ankles in a little bit. Okay. So on the inner part of the ankle, your ankles, like so. Get to where I can feel them. You have your posterior tibial, and they're strong bilaterally, right in this area. Okay, and then put your feet up for me. Okay, and then right here on the tops of your feet, you have your dorsalis pedis, and those are strong bilaterally. Okay, and that ends the assessment. Given report on a 22-year-old male who came in for a cardio and peripheral vascular assessment. Starting with the upper extremities, his arms were checked for symmetry and they were symmetrical. His hair distribution was equal. His skin was warm and dry to touch bilaterally. His skin turgor bounced back good bilaterally. The capillary refills were checked, and they were both under 3 seconds bilaterally. His hand grips were strong bilaterally. The brachial and radial pulses were checked on both arms, and both were strong. Then moving down to the neck, starting with inspection, there was no lumps, bumps, bruises, or lesions noted. And then no pulsations were seen. Then move to palpating the patient's neck, starting doing one side at a time to avoid cutting off any blood flow on either side. There was no masses or tenderness to palpation. Auscultating was then done using the bell side of the stethoscope. No bruits were heard. No abnormalities were heard as well. Following the neck was the chest area. All areas of the chest were auscultated while the patient was sitting and lying down, starting with the aortic area. All areas of the chest were auscultated using the belt and the diaphragm area of the stethoscope. This was done sitting up and lying down. Starting with the aortic on the right side of the chest in the second intercostal space, next to the sternum border, then moving over to the left side of the chest to the pulmonic in the second intercostal space next to the sternum border, then moving down to the Erb's point in the third intercostal space next to the sternum's border, and then to the tricuspid in the fourth intercostal space next to the sternum's border, and then in the midclavicular line down in the fifth intercostal space to listen to the mitral area. While the patient was lying on his back, the patient was asked to roll to his left side, so the mitral valve was also heard. When using the diaphragm, S1 and S2 were heard. S3 and S4 were not heard. Also, over the mitral area, the apical pulse was felt. Also, the areas were palpated over each of those areas of the heart, including all of the areas that I listed that we listened to. Also palpated using the ulnar aspect of the hand was the pericardium over the heart, and there was no pulsations felt, there was no tenderness, and there was no lumps, bumps, bruises, there was nothing no abnormalities noted. The patient was also asked to look all the way to the right and then all the way to the left, and in doing that, we were looking for or checking for any neck distension. None were noted. And following the chest area, we move down to the lower extremities. We started by inspecting. There was no edema, no varicose veins. His skin was warm and dry to touch. His hair distribution was even. The capillary refills were less than 3 seconds on both feet. His pulses were then checked, including the femoral pulses in the groin areas, his popliteals behind his knees, his posterior tibials on the inner parts of his ankles, and then his dorsalis pedis pulses on top of his feet. All pulses in the lower extremities were all strong and all felt. I think that's going to end the report.